Okay, so welcome to our webinar on an introduction to setting up a behavioral health practice, competencies, and considerations. We appreciate you taking the time to be able to be with us today and to get a little bit of information about the very basics of setting up your telebehavioral practice. Just a reminder that what I'm going to be sharing with you today is just a very basic introduction. We're going to be covering some of the main things that you would need to consider when shifting toward telebehavioral health. And I will also be sharing with you some references and resources in moving forward if you wish to continue to practice in this modality and how to become more proficient. So what is telebehavioral health? Telebehavioral health is any type of behavioral health practice that is mediated to some degree by technology. So this means that we are utilizing internet strategies, we might be utilizing webcams. It has been my argument for quite some time that it is also the case that we are engaged in teletherapy practices when we are exchanging texts and emails with clients as well. So it is a therapeutic practice for those who find it impossible or perhaps improbable to receive in-person treatment, which is a really important construct, I think, in today's world. In addition, we have to consider the rate of growth in terms of telebehavioral health. So this is any kind of type of practice where you're using video conferencing, as I mentioned, apps, telephone, remote patient monitoring, anything that is designed to improve access, promote quality care, and improve mental and behavioral health. It has been demonstrated in many types of research studies to be quite efficacious, particularly as it pertains to things related to social anxiety disorder, any of the cognitive behavioral therapies for treating eating disorders, etc. So it is a well-used treatment when it's administered appropriately. When we think about the field of couple and family therapy, in the United States alone, we are expected to increase in our numbers from 55,000 in 2018 to 67,000 in 2028, which is a 22% increase. So this growth rate of 22% is actually projected to be greater than growth in similar behavioral professions. So it's important that couple and family therapists are prepared to respond to these shifting demands, right? And to be able to move more towards being able to practice in ways that are going to keep up with these technological innovations. In addition, we have all become quite aware that health is very important, that we need to make sure that we are adhering to some of the standards that are set forth in terms of gathering in large groups or gathering in groups or potentially having clients who might be ill. And telebehavioral health provides an easy mechanism for us to be able to provide a standard of care with those types of clients. Today's webinar is going to be focused primarily on how you start a TBH practice. So we're going to be going over 4 main components in starting that practice. Number 1, how to use systemically oriented resources to help guide your work. Secondly, a reliance on core competencies and telehealth and technology, which we're going to look at. Third, we're going to begin with the novice areas of the 7 domains of core competencies of telebehavioral health. And then finally, I'm going to direct you to some sources for additional training and professional development. Okay, so the first thing we want to look at is how do we use systemically oriented resources to help guide our work? This is really important for couple and family therapists because the competencies and the work that we're going to be talking about with telebehavioral health really do lend themselves well to a systemic view. First of all, it's interdisciplinary. Telebehavioral health is something that is not exclusive to MFTs, but is inclusive of a lot of other mental health disciplines. They're systemic, and they really apply to the population of couple and family therapists. These competencies that we're going to talk about offer a broader perspective than competencies offered by some individual or siloed professions. We're going to highlight some of the commonalities that are shared among some of the behavioral health professions. And these competencies, because they're interdisciplinary, can help practicing couple and family therapists maintain quality of care as if done in person, while we're still attending to some of the issues introduced using technology. As a profession, couple and family therapy is really uniquely positioned to really be refining some of these things. Couple and family therapists attend to multiple individuals in the therapy room. And so we have to be thinking about how to do video-based work or telebehavioral health, not just with an individual in front of us, but how do we do that with children in the room, with adolescents, with maybe multiple people across distance, or maybe couples who are geographically separated, okay? So that's another thing that sort of lends itself well to a systemic view. Blummer, Hertlein, and van der Bosch came up with looking at some of these competencies early on. How do we conduct assessment processes that are going to be consistent with a telebehavioral endeavor? So that's an important document to look at. Another one that becomes really important is the Association of Marital and Family Therapy Regulatory Boards. They actually have a teletherapy guidelines document that was published in 2016. And if you look at this document, it gives you an overview. It talks about the process. And this can be downloaded. You can just actually type in Association of Marital and Family Therapy Regulatory Boards Teletherapy Guidelines, and the link to this PDF comes up. And so it talks about how do you adhere to laws and rules in each jurisdiction, how do you verify the identity of a client and that it's important to do that, how do you demonstrate cultural competence within the practice of teletherapy online, what your informed consent should entail or should include in terms of engaging in teletherapy, what are some of the acknowledgments of the limitations of teletherapy, how do you establish professional boundaries, how do you navigate toward an appropriate social media presence in this virtual world, what are some of the issues that emerge in terms of documentation and record keeping, how do you manage emergencies, and what are some of the important things that you need to consider in terms of moving towards HIPAA security, web maintenance, encryption, how do you back up data, things like that. Okay, so this is an important document. Now, these TBH guidelines that are presented by AMFT-RB, however, do not include the use of text messaging, email, online scheduling, related technologies. They are very explicit in this document that they don't talk about those. And so what I'm going to orient you today to is some of the core competencies that do actually address some of those things that are not managed in these teletherapy guidelines. Finally, a third document that's important for you to know about are the Best Practices in Online Therapy by Benjamin Caldwell and their work group. It summarizes the couple and family therapy literature, looking at the best practices, and it highlights some of the more relevant work and articles from which they've sort of pulled these best practices. So given that the document is from 2017 and there have been some other articles that have emerged from that time, you know, it's important to not rely on that document as the end all be all, and just recognize that after this document was created, it is a very wonderful document, and there have been some articles that have come out in the time since that. So looking at this, these resources I think will help MFTs in particular in setting up their work. The second issue that we want to talk about today, and we're going to spend most of our time kind of looking at these core competencies, is relying on core competencies in telehealth and technology. So interprofessional telebehavioral health, and we're going to refer to those as TBH throughout, competencies are developed in 2017 by the Coalition for Technology and Behavioral Sciences. And the main point of this group was to get together a group of practitioners who were across different disciplines, psychiatry, psychology, nursing, couple and family therapy, etc., and to come up with how we can ensure that practicing clinicians maintain the quality of healthcare service delivery as if this was being done in person. At the same time, we need to attend to some of the clinical issues that emerge when we're using technology if that criteria hasn't necessarily been identified. So I've highlighted some of the notable individuals in this group, Marlene Maheu, Don Hity, Kenneth Crude, and so you might recognize some of those names. I encourage you to look up some of those names as it pertains to telebehavioral health so that you can also put that in your toolbox. So the main idea, again, is that we have these practicing behavioral health therapists who can maintain the quality of care as we do in person, and then secondly, to make sure that we are giving some solid competencies for people who are transitioning their practices into an online setting so that we are attending to some of the unique elements of an online or telebehavioral practice. To do this, we looked at a lot of sources. So we looked at some of the sources from the states. For example, we looked a lot at the telepsychology and telemedicine guidelines from California and from Ohio and Pennsylvania. We looked at the American Psychological Association and some of their documents that talked about telemental health and telebehavioral health. We examined the documents from the American Telemedicine Association, the American Counseling Association, the American Association of Marriage and Family Therapists, the National Association for Alcoholism and Drug Abuse Counselors, and the National Association of Social Workers. The National Association of Social Workers has a rather large and robust and very detailed document as it pertains to telebehavioral health. So again, that would be another resource that you might be able to tap into if you're looking for more specifics on how to engage in some of those telebehavioral health practices. So please know that the competencies we're going to be presenting have been informed by all of these organizations and associations. So the third thing you're going to do in terms of setting up your practice, so you're going to be, again, looking at the systemic-oriented materials. You're going to be examining some of the, acknowledging rather, some of the core competencies. Then we start looking at where the rubber meets the road. What do I actually do when I'm setting up my telebehavioral health practice? So we'd like to talk about beginning with the objectives and the novice skills of the 7 domains in the core competencies of telebehavioral health, okay? So these core competencies are clinical evaluation and care, and it has a couple subdomains addressing cultural competence and diversity, as well as documentation and administrative procedures. It has an element for virtual environment and telepresence. That's the second domain. The third domain is technology. The fourth domain is legal and regulatory issues. The fifth domain is evidence-based and ethical practice with a subdomain in social media. A sixth domain of mobile health and apps. And then the seventh domain of telepractice development. So when we were working on this in the task force, and you'll see that I've got the citation here of Maheu, Crude, Hertlein, Lipschitz, etc. This is from the Journal of Technology in Behavioral Science. It is, the title of the article is A Correction to an Interprofessional Framework for Telebehavioral Health Competencies. Please make sure when you look it up, you get the correction to, because actually in the original article, I don't believe they actually put the table of competencies, which was kind of interesting. So anyway, so looking at the correction to an interpersonal framework for telebehavioral health competencies. And you can have the entire list of competencies while accessing this article. The article itself is about 32 pages long, and the competencies make up a good chunk of that, starting from page 126 and going to page 140. So what I'm going to do today is obviously not go over all of those competencies. You can pull up that article and look up exactly each competency skill for each area. But again, we would like to cover today, starting with the novice skills, the most basic skills you will need to set up your behavioral health practice. When we think about those telebehavioral health competencies and how, again, they are organized, each area has a series of objectives that we're going to be going through. And so we'll go over the objectives and talk about the three different levels of proficiency: novice, proficient, and authority. So each of those areas or skill sets or level of expertise, if you will, has specific knowledge and skills associated with them, okay? So if you function at a novice level, it's expected that you have a certain group of skills. If you function at a proficient level, it's expected that you have a certain group of skills, etc. So as a whole, there are 149 individual practices. For the sake of time, I'm not going to review all of the 149 skills, but I am going to talk in detail about what are some of the objectives for each of these domains, and then what are some sample skills that you're going to need at the novice level to be able to walk into your practices today and get started. So the first one we're going to look at is clinical evaluation and care. So this is the domain where, it commonly includes triage. We're looking at assessment and diagnosis. So it's not just something that's happening in terms of best practice in your room, but we're looking at best practice across all sorts of levels, what your state or provincial level says, what your professional standards are. So it's a very broad perspective, which is why it has a couple subdomains. This is actually the largest of all of them and contains 3 subdomains. So you've got assessment and treatment as one subdomain, cultural competence and diversity, and documentation and administration procedures. So just looking at kind of that first subdomain, the assessment and treatment, right? We're looking at your assessing for patient appropriateness for telebehavioral health services. You're looking at monitoring the patient for comfort with telebehavioral health. You're attending to how you apply to some of those in-person standards. you're implementing a service plan, you're looking at therapeutic engagement, and you're trying to make sure that you identify and maintain some of those professional boundaries. So again, some of these examples in terms of looking at the skills from a novice level, you might look at the presenting problem that some clients have and decide that telebehavioral health might not be appropriate, okay? So again, we have a lot of evidence that suggests that telebehavioral health would be appropriate for people with depressive disorders or anxiety, but perhaps there's another element to what's going on for the client where you don't think that would be particularly helpful. There also may be clients who are not comfortable with being in a virtual environment. I can think of a client I have right now who insists on in-person treatment. So this particular client would not be comfortable with that. So you've got to develop a strategy that evaluates whether your client would be comfortable with that. You're also looking at the in-person clinical care requirements. What are your requirements in terms of triaging treatment? How do you make decisions about consultation or supervision as necessary? You know, how have you organized within your own practice to report either to law enforcement or to another family member if there is a suicidal or homicidal threat? How do you triage that, and how are you going to transition that into online care? You've got to implement a TBH service plan that's going to be appropriate to your client's needs. Another skill, another novice skill to develop in this first subdomain of assessment and treatment is looking at how you monitor therapeutic engagement, how you monitor intimacy and other behaviors, as well as abrupt accelerations and declarations, or decelerations rather, that might be related to technology. So we have to figure out what are the strategies that you're going to put in place with the client in case something happens with the technology that's going to interfere with your treatment. For example, you might be in a situation where you have a slow internet connection, or your client has a slow connection, and that's going to impair treatment. What is going to be your backup plan when there's this abrupt disruption of treatment? We also need to consider how you maintain and identify some clear professional boundaries with clients and patients. So a skill that you might develop here could be a statement that you talk about with clients with regard to when they can contact you via cell phone or via text and when they can't. Do they understand that you're not likely to respond after a certain time of day? As long as they don't have those expectations, then you're going to be able to ensure that you can provide quality care. So again, it's about identifying what is appropriate for you as a practitioner, communicating that with your client, and then documentation of that conversation. And then finally, looking at seeking consultation and supervision if boundaries or things get a little bit wonky, things that might impact the therapeutic frame. What is your plan for seeking consultation and supervision if there is a disruption in terms of the boundary setting, and making sure that you have a clear plan established for when you're going to notice when things are occurring in terms of boundary violations and what your next steps are going to be. Okay. So those are some of the skills under this first kind of subdomain in the objectives of clinical evaluation and care. The other objectives, the ones under cultural competence and diversity, we're talking about assessing for cultural factors that influence care, ensuring communication with a reasonable option in terms of language, and creating a climate that encourages reflection and discussion of cultural issues in sort of an ongoing manner. So skills that you might develop related to this subdomain talk about exploring with an attitude of cultural humility and an interest in learning, looking at consultation to maybe address some challenges that you might have, talking with your client about what their native or primary language might be, and identifying strategies in terms of using a certified language assistant service if you need that kind of technology. And then again, contributing to a climate of being very humble and identifying when there's going to be some commonalities and differences between you as the professional and your client. Other objectives in the clinical care domain relate to documentation and administrative procedures. One of the things that I've been asked before is if you've already got informed consent for your client in an in-person setting, can you just verbally give the okay for a technology setting? And the best practices would be to still get a written informed consent when you transition to a telebehavioral health practice that is recommended by the Zur Institute. You have to acknowledge with the client that there are different risks associated with telebehavioral health. And so you have to adapt to those TBH practices. You have to document your TBH practices according to requirements. And then you have to make sure that you are communicating what some of those administrative procedures might be. For example, a therapist who's just beginning telebehavioral health, you need to work with them to identify when specific informed consent is required over email, since email is not HIPAA compliant, text is not HIPAA compliant, and clients need to know that. We need to identify some operational procedures, that what happens when you've taken things online, what do you have to adhere to in terms of your state board. You need to review any standards in advance of implementing them, particularly looking at reimbursement and billing codes, making sure that your state does reimburse for telemental health. There are some states that do and some states that don't. So you just want to make sure that, and there's actually a website that looks at reimbursement for telebehavioral health and gives you the most recent updates in terms of the states, in terms of what they reimburse. So that would be a good site to look at. And again, making sure that there is documentation about how you're going to move forward if the technology sort of breaks down. What are going to be the backups? So that is the overall view of the clinical evaluation and care. The next one is virtual environment and telepresence. So here we are applying appropriate techniques to maximize the therapeutic atmosphere. Here our objectives are to really looking at, I'm sorry, it looks like I have if I'm looking at virtual environment and telepresence, okay, so it looks like the domains I have there are incorrect, so I will have to send an updated version to you if you'd like. But it describes the aspects of telepresence. We adjust, oh no, I have them. This is right, so we adjust the clinical environment to be conducive for TBH. We adjust technology to facilitate our presence. We're creating an environment that's free from distractions, and this is really, really important. So when we're talking about this virtual environment, the skills that a novice therapist needs to have as they're opening up this practice is being able to describe telepresence. So it means that you're creating an inviting environment. It means that when people are looking at your screen, they feel like they're in a therapist's office. You've got to be paying attention to the walls behind you, right? You've got to be setting it up so that when people are looking at your screen, it looks like it's still this inviting space, okay? So you're recognizing that these asynchronous technologies too may affect telepresence. So a lot of times people think that asynchronous technologies like text are really synchronous. And so they reach out to a therapist expecting an immediate answer. Well, perhaps I'm with a session, or perhaps I'm doing something else with another client. I can't immediately get back to you, okay? So therapists who are very good at doing this are very clear with their clients about what it is that is asynchronous, what it is that's going to take some time for them to get back to, and what it is that they'll be able to answer to right away. We know that therapists who answer right away are creating a different level of social presence than therapists who don't respond right away. And that just happens in relationships too. It's not just therapists, right? People you feel closest to are people who are responding right away. So we want to make sure that we're clear with clients about the limits in terms of when we're going to be available, but also acknowledge that when we're replying to clients' texts or emails, there is a sense of presence, like we are there. So we have to be able to, as a very base level, list the pros and cons of the features for that physical space. We offer alternatives to technology to optimize engagement. Maybe we recommend that there's a larger screen, or that we're using a different selection of software technologies. Another skill is creating a distracting-free environment. This means you don't have alarms going on for text or emails. You're not emailing while you're with a client. You're not on the telephone. You're going to eliminate distractions with kids or pets, right? So we make sure that we don't have that stuff distracting. Again, we're assessing for client styles in terms of communication, and make adjustments for things that don't make sense within their telebehavioral presence. Then we have the technology piece. So again, we're looking at patients' comfort and use with technology, but the bottom line is, can the therapist actually utilize technology in a skillful way? So some skills that a very basic therapist needs are to be able to inquire about the client's experience and exposure to clinical care with telebehavioral health. Have they ever done this before? Are they at ease with technology? Do they trust technology? Secondly, a base skill is to identify the pros and cons of technology in terms of meeting your client or patient goals. Are there preferences and capabilities that we can use that would be helpful? We want to be able to demonstrate skill in operating selected technology equipment, making sure that we have the microphone going, the camera going, we know how to troubleshoot some issues, how to manage interferences and interruptions. We want to educate clients on how to use selected technology and troubleshoot those roadblocks. So you want to make sure, as you start to move toward TBH practice, that you have given a client some sort of document or some sort of video that helps them troubleshoot some of those basics. So when they emerge, the client has the ability to be able to do that without having to connect to you to resolve it, because they may not be able to do that. And then finally, recognizing the need for evidence-based services when using technology. Certainly, we just can't operate from a practice where we sort of forget everything about how to move forward with our practices. We're still using the same sorts of theories, the same evidence practices we'd be doing if we were meeting face-to-face, but we have to still recognize that we might be able to still accomplish and still engage in those evidence-based practices when using technology, okay? So that might be focusing on researching or consulting others who are really good at these practices to see what we could pull off in terms of that evidence base. Legal and regulatory issues is the next domain. And here we're really looking at adherence to some of our local and federal laws, particularly as it pertains to privacy, confidentiality, data protection, interjurisdictional practice, communication standards, et cetera. So this is, again, organized in different competency levels, but we're really interested in adhering to TBH laws and regulations. We want to practice in accordance with and educate others on regulatory requirements. We're applying in-person standards to TBH and looking at overarching jurisdictional issues. So what does this mean in terms of the skills you need? It means we need to communicate with relevant authorities and figure out in your state at the time of contact, what are the laws and what are the things that we need to attend to in terms of applying our in-person practices to shifting toward telehealth. So we need to be able to articulate why you need to be informed and have training on the duty to follow in-person TBH legal and regulatory standards. You have to know, for example, if you have determined that part of what's happening in person is an individual would like a great deal of privacy, you have to make sure that you're knowledgeable enough about privacy laws and about what's happening with TBH to be able to communicate with some level of confidence what the privacy would look like in transitioning to an online setting. So this means making sure that you are using software systems that are HIPAA compliant and that follow and adhere to our regulatory standards. This means that we're also advising clients that, again, texts and emails are not HIPAA compliant, and that we make sure that any correspondences shared with them in this manner, they also have some knowledge that they need confidentiality in some way. So one of the things that I've done is created an electronic communication document so the clients are aware of the limits of privacy as it pertains to email and text messaging, and then they can choose whether that is something that they still want to use in terms of communication with me. But I'm very clear with them that here are the risks, and that's a separate document that they sign off on. This, we also want to make sure we're applying the in-person regulatory standards to TBH. So again, if you see something that's happening in practice in terms of like duty to report, that in-person regulation still applies to TBH. And then making sure that you seek advice for TBH outside in advance. So you're making sure that you are aware when something atypical might occur, if there's maybe a mobile population or if there's an emergency circumstance or something like that, that you are able to adjust and document when you're making changes to processes. The next element, the next domain rather, is evidence and ethical-based practice. So there are a couple objectives on this slide and the next slide as well. So here, I've included some for social media, but as well as some of the evidence-based practices below. So we need to make sure that we're assessing the use of social media. We are identifying and monitoring some regulatory and privacy issues that might emerge. It applies to in-person and regulatory rules. We're creating a climate of reflection and discussion in terms of social media. But the main idea is within evidence-based and ethical practice, we want to be able to identify, employ, and develop documents for the ethical service of telebehavioral health. We want to make sure that we compare in-person ethical issues to some of the TBH ethical issues, right? And we want to make sure that we continue to have conversation about it, because this is what's going to create a climate of reflection and a climate of discussion around it, okay? So if we look at just some of the skills that you might need for this, We're looking at identifying documents in your own profession for reference and or clinical decisions. So maybe you have attended a conference or a workshop related to TBH and you want to modify some of your documents and informed consents that would reflect that. That's a great idea. We want to make sure that you demonstrate knowledge of social media and other digitized information regarding potentially their negative impact on clients. So we want to be mindful that clients might come across certain self-help websites and apps and things that are targeting them for identified disorders. And we want to make sure that we are knowledgeable enough about those apps to be able to appropriately discuss those with the clients and identify which ones are legitimate, which ones might be more helpful for their particular circumstance, etc. We can talk, another skill is discussing appropriate uses of social media for clients as well as within the clinical relationship. You want to be able to identify evidence-based TBH research in your own profession. We're going to be talking about some of the places at the end of the presentation today that you would be able to get information about TBH practices and maybe even develop some ideas about how you want to revise your own informed consent documents and documented meetings with clients. You want to make sure that you have a group to be able to discuss difficult or maybe unclear ethical TBH topics with colleagues. And then finally, engaging a supervisor or someone who's familiar with TBH to be able to apply some of those decision making. So again, be thinking about who is knowledgeable in your profession about TBH and see if you'd be able to utilize that individual on the side for whatever, what might come up. So sort of having someone that you could go to, maybe kind of an on retainer basis to pop some ideas through. So that will help in terms of your evidence-based and ethical practice. Okay, so again, when we talk about social media, we talked about educating yourself, but another part of this education piece is making sure that you are providing positive and negative uses and educating yourself about those in terms of predictive analytics, looking at websites, cameras, things that would make a difference in terms of your practice. So again, this might be looking at what is more commonly used in MFT to make sure that whatever technology you're going to use is something that is HIPAA compliant and something where you can communicate from an ethical perspective, here's why I chose to use this, and letting the client know why you did that. Okay, so let's try this again. Let's go all the way down here to where I was. Mobile technologies. Zoom slideshow. Okay, so we want to assess mobile health technologies. This means we screen for inquiries about clients' rationale for using a specific app. We educate clients that TBH apps should be evidence-based, and we engage in conversations with them about diaries, data logging, symptom reporting. We are compliant and identify apps that are compliant with legal, regulatory, and ethical requirements, okay? So that's the main issue behind mobile health technologies. And then our final domain, thank you for hanging in there with me on this, telepractice development. So we're using technology to create and maintain your professional identity. And you've got to be really, really careful about this, right? Clients look you up and they know who you are before they even walk in a room. So here we want, I think we keep losing our connection. I guess I'm, let's see, here we go. So we're on this last one. Telepractice development and objectives. So it looks like we could, all right, so we want to make sure that you can identify the difference between marketing online versus the impact versus offline. Acknowledge that there's an impact of social media on your interactions with others. You're following your ethical and legal requirements with regard to testimonials. You're not basically telling people, oh yeah, put a testimonial, because that would violate a client's confidentiality. And then making sure that you include components of cultural differences. Finally, to sort of wrap it up here, obviously this was just kind of a quick snapshot in terms of what you should be working on when you're setting up your practice. We want you to seek sources for additional training and professional development. I would like you to, of course, visit the documents, those systemically oriented documents. That was for point number 1. But after you've set up your practice and you want to make sure that you are on par with what is expected from a professional standard of care, we encourage you to check out the Telebehavioral Health Institute, the Zur Institute, and that website is here, Person-Centered Tech, other programs offered by state and national professional associations, and then engage in a course of self-study. Certainly, I'm available. I'm at catherine.hertline@unlv.